This lecture will help us prepare for the last few weeks of the Pharm 351L Community Pharmacy Practice sections. We will take a closer look at some things that will advance your abilities in order to prepare you for your summer IPPEs and also for the remaining lab activities and your skill assessment. Here's a snapshot of some of the things we'll be doing. In lab, in the upcoming weeks, you will be adding a new patient to Pioneer Rx. This is a common example of what happens in a pharmacy. When a new patient comes into the pharmacy, we do have to gather demographic information in order to ensure we're filling the prescription for the right patient and in the safest manner. You will be transcribing a phone-in prescription. Most prescriptions come in an electronic format into your dispensing software. However, there are still instances where providers call in the prescription. These will be saved as voicemails on your computer desktop to get you comfortable with this process. In the past, when you've checked the dose of the medication, all of those have been accurate. That will not be the case in the next few weeks. You will be practicing how to communicate recommendations of therapy changes to the prescriber. You will be calling the prescriber in order to make these recommendations. You'll be learning how to document changes on the hard copy prescription. You'll learn the ins and outs of dispensing tablets and capsules, as we've only dispensed atypical dosage forms to this point. We'll be revisiting open-ended questions consultation, as the next 3 weeks will require open-ended questions during consultation time. And we'll do a little refresh about errors and omissions so you feel very comfortable with those as well. When you receive a prescription via voicemail or telephone call, it's important that you confirm that information and make sure that the patient has filled at your pharmacy before. If this is a new patient, then you will need to enter some demographic information. Remember, we collect things like date of birth, allergies to medications, gender, in order to ensure that we can run appropriate screenings to make sure that the patient's medications are safe. In your binder, you will see a page representing the patient that you'll be filling for the next 2 weeks. When you open up your binder, you will see a picture of the patient along with some demographic information. Oftentimes, we can gather some demographic information from a hard copy prescription or directly from the patient when they present to the pharmacy. I have provided this for you, and you will enter this information into Pioneer Rx. We will be adding a new patient to Pioneer Rx. You will go to the Patient tab and click the green plus sign. Here, it will ask you for information for your patient. You'll get this information from your binder. The last name, comma, first name, and then press enter. It'll ask you for the street address. You can input it just like it is in your binder. It may give you a warning that says address not found. That is okay. You can just override that. You do have to enter a phone number. You can just make one up if it's not included in your binder. You also need to add a date of birth. This will be included in your binder. I usually like to do two number date for each section, followed by the year. Then it'll make you choose a gender. Make sure you are choosing a gender. It will not let you move forward from there. And then you need to add allergies. So you'll select yes. And my patient is allergic to fluconazole. I'll press enter, select the fluconazole and click next. Here I will write in comments. I see that the patient had an upset stomach. You don't need to worry about changing these severities. This would be done in clinical practice, but we don't have access to the patient, so you can leave it how it defaults. Click Save and Close on those, and you should be ready to go. When you receive a prescription via voicemail or telephone call, it's important that you confirm that information and make sure that the patient has filled at your pharmacy before. If this is a new patient, then you will need to enter some demographic information. Remember, we collect things like date of birth, allergies to medications, gender, in order to ensure that we can run appropriate screenings to make sure that the patient's medications are safe. In your binder, you will see a page representing the patient that you'll be filling for the next 2 weeks. When you open up your binder, you will see a picture of the patient along with some demographic information. Oftentimes, we can gather some demographic information from a hard copy prescription or directly from the patient when they present to the pharmacy. I have provided this for you, and you will enter this information into PioneerRx. Up to this point in the concept pharmacy, all of your prescriptions have been electronic prescriptions, or prescriptions that have come across through our dispensing software system that were electronically prescribed to the patient. At this point, we will be switching gears a little bit. There are still instances when prescribers phone call in prescriptions for use. You will be transcribing these phone-in prescriptions on a blank prescription page. If you notice on this slide, the blank information that you will be provided would be anything that's not handwritten in. As a reminder, there are certain things that are required on a prescription in accordance with North Dakota pharmacy law. You will be required to add all of this information based on the phone call. Your voicemail will sound something like, "My name is Vicki, and I'm a nurse calling in from Dr. Aronson's office. I'm calling in a prescription for your patient. The medication is simvastatin 10 milligrams for the treatment of her hyperlipidemia. Directions are 1 POHS, quantity number 30 with 5 refills. Thank you." So that's what it will sound like when you listen to the voicemail. When they say your patient, you will be adding the patient's name from your binder page that has the picture of the patient and the demographic information that you added for a new patient in PioneerRx. You will not be given the patient address in these phone calls. You will have to look that information up in PioneerRx. So as you're going through, you will listen to that voicemail, document everything, and then you do need to listen to it twice. You'll notice that on the hard copy prescription, there is a small number 1 that says T.O. per Vicki. So you'll notice that the nurse's name was Vicki. TO stands for telephone order. They likely won't give you their phone number, and that's just fine. You do not have to have a callback number. Then, after I've documented all of this information, I would proceed on to listen to the voicemail twice to ensure that I documented accurate information. You'll notice that I placed check marks after everything. That is noting that I actually listened to that voicemail twice, and here in this circle, you'll see my initials HE and the date. That is noting documentation that I did listen to that voicemail twice. So as you're recording that phone call and prescription, you'll put in the patient's name that you have in your binder. You'll listen to the call once. Underneath the line, you might have to write telephone order per Vicki. If it was Dr. Aronson calling in this prescription, you could simply leave it as Aronson here on the MD line. Then after you've listened to it twice, you will somehow note that on the hard copy prescription. I put my initials and a check mark and the date. Some people note a 2X for 2 times their initials and the date, but somehow that needs to be done. You'll notice in italics on the slide here, in the NDPHA concept pharmacy, you must document that you verified the prescription by reading it back to the provider or by listening to the voicemail twice. If it was an active phone call, not a voicemail, you could say something like, "Just to make sure that I got all of the information appropriate, can I please read it back to you for verification?" This slide is a reminder of the requirements for a prescription. I've bolded 2 of the things here to remind you that a patient address is required on the hard copy prescription. So you do need to add that into the prescription when it's a voicemail. Also, if the prescription happens to be a controlled substance, you do need to add the prescriber's DEA number. We can help you find that in PioneerRx if it's necessary. All right, so as we're doing our prescription processing, this slide should look very familiar. You always want to make sure that the equipment you are using is clean. You verify the validity of your prescription in accordance with North Dakota pharmacy law. You check allergies to the medications in the patient profile and document on RX. And then, using your available resources, you verify the directions are appropriate. In the past activities, your directions have always been appropriate. That will not be the case as we move forward in these weeks. So what do you do if you look in Micromedics and the directions are incorrect? You cannot change directions on a prescription without the prescriber's authorization. So you would collect the information that you would like to recommend and make a phone call to the provider's office. You'll be practicing this in the concept pharmacy over the next few weeks. When you are calling into the provider's office, you will actually be calling one of the faculty members. We have an in-house phone system that works kind of like walkie-talkies, and so it will not be a real provider's office, but we will be acting as the provider or the provider's agent like a nurse. This slide is very important. I've made a star on the slide. I suggest you do the same, but this is the information that you need to communicate when you make that phone call. I've found, teaching over 15 years, that with generational changes, students are less comfortable making phone calls than they used to be. So this is a really important time for you to practice this skill. I encourage you to practice this at home, practice this with your peers, and you will be given feedback during lab weeks as well. So when you are making a call to the provider's office, you will say who you are and your credentials. When you are in the concept pharmacy, you are the pharmacist, or you can say you're the student pharmacist. Where you are calling from, you will be calling from the NDPHA concept pharmacy. Who you are calling about. This should include the patient's first and last name and their date of birth. If you do not give the patient's date of birth, we cannot allow the call to proceed, as any healthcare provider's office would require this information. What was prescribed and when? The when is very important. If they are looking in the patient chart, they, as in the nurse or the provider, they will likely need to be able to pull up the appropriate document from the date that was prescribed. And then your recommendation. You are the medication expert. This must include the name of the medication, the dose, the route, the frequency, and the quantity. I'm going to do one more complete example of a phone call prescription. Hi, my name is Heidi and I'm the pharmacist at the NDPHA Concept Pharmacy. I'm calling about patient Callie Alexson, date of birth 2/24 of 1996. Dr. Aronson prescribed amoxicillin 500 milligrams, 1 tablet by mouth twice a day. This was prescribed on February 18th. The quantity was for number 20. Based on the information that I was able to see in our drug information resource, I would suggest that this medication actually needs a higher dose. My suggestion would be amoxicillin 500 milligrams, 1 tablet by mouth 3 times a day, quantity number 30. Would this be okay with Dr. Aronson? Here's an example of a prescription that was called in. The prescription would have been called in something like this. Hi, my name is Dr. Aronson. I'm calling a prescription for Joan McMowen. Joan needs famotidine 20 milligrams for treatment of GERD. The directions are 1 PO/QD, quantity number 30 with 3 refills. Thank you. So then you as the pharmacist would go in and look up famotidine 20 milligrams in Micromedics. The directions should actually be 1 tablet by mouth twice a day. You will gather this information and then call Dr. Aronson's office back. When you make that phone call, it would sound something like this. Hi, my name is Heidi. I'm the pharmacist calling from the NDPHA Concept Pharmacy, and I'd like to speak to Dr. Aronson or one of Dr. Aronson's nurses. Great. I have a prescription, like I said, for Joan McMowen. Her date of birth is 5/26/1946. Dr. Aronson called in a prescription for famotidine 20 milligrams with directions of 1 PO/QD, quantity number 30 with 3 refills. And this was on February 18th of 2022. I looked up this information in our drug information resource, and it looks like the directions for more appropriate use would be 1 tablet by mouth twice a day. Based on this recommendation, we would change the quantity to 60 and leave the refills at 3. Would this be okay with Dr. Aronson? Okay, so you noticed that I introduced myself, talked about the recommendation, talked about the quantity change, who I was, where I was calling from. So it's important to make sure that all of that information is communicated. When you're communicating a change, it's important to not sound accusatory. You don't want to say Dr. Aronson was wrong. You don't want to say I found better information. You simply state, according to my research or according to my drug information, I see that there might be a more appropriate dosing suggestion. Notice that I also changed the quantity. If the prescriber originally wanted a quantity to last 30 days, we need to adjust the quantity to last the 30 days as well. For example, if you were changing something from BID to once a day, you would go from a quantity number 60 down to a quantity number 30. Here you'll notice that the documenting changes to the prescription occurred where under the directions where it says per Nancy. So I, as the pharmacist, was talking to Nancy, so I will write per Nancy on the date and my initials. You'll notice that I draw a very simple line through the directions and a line through the quantity. You don't want to erase that information. You don't want to scribble it out. It's important that that information is maintained so that we can see a trail of what has happened with this prescription. This is an example of one of our previous students' binder pages. You'll see that the student has actually gone through and documented everything. You'll see that the prescriber's name is listed. The DEA number is listed there, although that's not necessary. The student wrote what the max dosing should be based on their recommendation. They called the prescriber, they crossed out what was changed in the directions, they crossed out the change in quantity, and then they wrote change okay by Amy, who was an RN, the date, and the student's initials. So this is an example of what your page should look like after a phone call prescription and documentation of those changes made. The documentation of the appropriate dosing does not have to be right there. It can be on a scratch sheet of paper, on another binder page, whatever, but the documentation does need to include a line through any information that was changed and that the change was okayed by the person's name, the date, and your initials.
Today we are going over how to count tablets and capsules and also put them into vials. So the main things you'll need are a counting tray, spatula, some vials, and caps, so either safety or non-safety cap, and an alcohol swab, and then of course your stock bottle of the medication that you will be counting. So the first thing that I wanted to mention is that counting trays are normally for right-handed individuals, so if you are left-handed, you want to ask for a left-handed counting tray. Okay, now that we have our supplies, the first thing we're going to do is clean off our tray. As you can see, mine has a little bit of dust on it from previous use. So we'll take our alcohol swab and just wipe it down to make sure it's nice and clean. All right, and I picked my drug already. It's right here, and I checked the NDC to make sure it matched my label. And I saw on the label that I will be counting 30 tablets. So I'm going to dump out just an amount that I think I know won't get to 30, but you can always dump more or you can always put more back into the bottle if you dump too many. So obviously this is more than 30, but I did that for purposes of this video. So what I do is I like to kind of shake the tray to make sure everything's flattened, but you can find the process that works best for you, but I don't like my pills to be on top of each other. And when you count, you want to count by fives. That is the number that's the easiest first to count in multiples of, and our brain can actually see fives fairly well. It's an easy number to like mentally picture. So what I'll do is I'm going to open up this little door here. So you can see here, I'm opening up this plastic door, and I'll start counting by 5. So 5, 10, 15, 20, 25, 30. Okay? So I've counted my 30, and obviously I have a bunch left over. And I need to put those back into the stock bottle. So all counting trays have a little kind of emptying place in the upper corner. And so you're going to use that to put your pills back into the bottle. So right there. So now I just have the pills I need in the little compartment right here. Next, I will be picking which vial I think is best suitable. So always pick the smallest vial for the number of pills that you have. You don't want to place these 30 pills into a giant bottle, because that's just first of all, waste of material. Second of all, for a patient, it's a bigger bottle that they don't necessarily need to be carrying around. And as you can see, there are different sizes of vials. So here's a couple. We even have ones like this. So we have a bunch of different sizes. So depending on how many pills you end up counting will make the decision of which size vial you'll use. But always try to pick the smallest vial you can for the number of pills that you have. So I'm picking the small vial. And now, so I have my pills in the compartment here, and I'll be using this spout to dump them into the vial. And a tip that I learned from a pharmacist I worked with is try to cover the space in between here as much as you can to avoid dropping pills on the floor, which I have done in the past. So try to cover this up the best you can with your hand and make sure they're all in there. And next we will pick which cap we use. So there's both safety and non-safety, and this does make a difference because some patients require easy open caps because they have arthritis or it's just very difficult for them. And I have had patients come in to the pharmacy and have me personally open their vials for them because they were given the wrong cap. So just make sure you pick the right cap. So here's an easy open one right here. And then we have a safety one. And you can tell the difference because these have a big plastic and you have to push them in order to open them. So I'm putting a safety one on because that's usually the standard. So here we are. And then we will label our vial. And I just have a blank label here, but just to show you. This is how I normally do it. I start on one side, kind of push it down, spin it around in right here. But you'll find a process that works for you. But I think I've just learned that's best. You want to make it as elegant as you can. Being in a pharmacy, you've heard pharmaceutically elegant, but just making sure you are as clean as you can with all these labels is ideal. And then for auxiliary labels, you can pick what you find to be appropriate for the medication. So for instance, if you had a medication such as metformin that it requires usually to take it with food, make sure you put that label on there. And you always want the auxiliary labels. Usually you put them in this little space right here on the back. And for lab, you will be putting them horizontally like this. Now we'll be going over open-ended questions, and this is a form of counseling that you will be using in lab from now on. It'll be required that you incorporate these questions into your counseling with patients. So some benefits of open-ended questions are that you can find out more information about the patient, such as the presence or absence of side effects, adherence issues, as well as their level of understanding about their medication. And with open-ended questions, conversations have a better flow and are more natural, and they also allow the patients to express their concerns. So here are the examples of open-ended questions that you will be using in lab, and you can see that there are highlighted words, and these words prompt for more than just a yes or no answer. So the first question is, what did the doctor tell you this medication is for? And this can bring about the name and strength of the medication as well as the indication of the medication. Next question is, how did your doctor tell you to take this medication? And this is a question I use quite frequently while I'm counseling patients and on both rotations and at my workplace. And from this, you can get a lot of things across to the patient. So directions for use with the dosage form, special instructions for specific dosage form, the duration of therapy, refill information, missed dose information, and the proper storage instructions. And the last question is, what did your doctor tell you to expect from this medication? And this will bring about the common adverse effects and how to manage them, as well as techniques for self-monitoring, including a time frame. And as you can see, when you ask these questions, you can still get the same required counseling points across, but it allows for a much better flow of conversation.
We will be doing some errors and omissions hands-on in lab over the next few weeks. I'd encourage you to refresh your knowledge about errors and omissions and the process that's used to check prescriptions. So again, this is something that you will do on your board practicum for the North Dakota Pharmacy Licensure. It's also something that will be assessed your P3 year. So we want you to get plenty of practice with it this semester. So I'd like you to remind yourself of this guide, read through it briefly, and then remind yourself of the process used in checking prescriptions. Remember, we outlined that process so that you have a system and an order of how you check things that makes the most sense for the dispensing process. The next slide will remind you of that process.
So you'll want to establish a process when checking prescriptions, and the first thing you're going to do is review the written or electronic prescription and ask yourself, are all legal requirements of a written or electronic prescription present? And the next question you'll ask is, are the prescribed medication, strength of medication, and directions for use appropriate? Secondly, you'll compare the prescription label to the written or electronic prescription. And you'll ask yourself, does the prescription label match exactly what was printed on the written or electronic prescription? Next, you'll compare the dispensed medication to the written or electronic prescription. And you'll ask yourself, does the medication dispensed match the medication prescribed? Then you'll check the NDC number of the medication. And you'll ask, does it match the NDC number on the prescription label? And the NDC number is the identifier for the medication, so if this is incorrect, then the medication is incorrect as well. Finally, you'll check the cap of the vial. And a child safety cap should be used unless noted on the prescription to dispense a non-safety cap, which is designated by NSC, or on the prescription label, it'll be designated as EZ for easy open caps. Now we'll be going over some common errors that are found in pharmacy practice. The first being the prescriber signature is missing. So if the prescriber signature is missing or it isn't an electronic signature, then that is an error. The date the prescription was written is missing, or it's inaccurate when placed on the label. So I've seen this sometimes where a patient will bring in a script that was written a couple days ago, but it is entered as if it was written for the day of. Next error is a prescription is expired. So prescriptions for non-controlled medications are valid for 1 year from the date written, whereas prescriptions for controlled medications are valid for 6 months from the date written. So there is a difference in how long they are valid based on if they are controlled or not controlled. And a note here that's in red is that in lab and for the board, you shouldn't worry if the date on the prescription is, in quotes, old. So some dates that you'll notice in lab and when you're taking boards, they may be back in 2017, 2018, and do not worry as long as they match the prescription and the label, then it should make sense. And then the last error is the strength of the medication or the directions for use are missing or are inappropriate. Another error is the incorrect quantity of medication is prescribed. So this is common with antibiotics. A doctor will write to take 1 tablet twice daily for 7 days, let's say. But then they'll write for a quantity of 10. And this is misleading because based on the directions, there should be a quantity of 14, so that is an error that needs to be verified with the doctor. Next, the patient's address is missing from the written or electronic prescription, so verify that an address is present. Another is prescription for a controlled medication is missing the prescriber's DEA number. This is required by law that a DEA number is present. A prescription for a controlled medication authorizes as needed or PRN refills. So the most refills that are allowed for a controlled medication is 5. And for a C2 medication, the next bullet point, a C2 medication cannot have refills. So it's a one-time only prescription. And the last error on the slide is medication prescribed is spelled incorrectly. So this is another error. The next error is the information on the prescription label does not match the information on the written or electronic prescription. So when comparing these two to each other, a number of things can be incorrect, including the number of refills, the prescriber, the patient name, the quantity of medication, and the medication or strength of medication. The next error is the directions for use do not match those on the written prescription. And an example of this is that the directions for use must specify a medication dosage form. So if the medication dispensed is a tablet, you must ensure that the directions for use specify a tablet. And it is considered an error if the directions for use would say capsule instead of a tablet, so verifying that the dosage form is correct. Another question to ask is, are the directions for use spelled correctly? Another thing that we should note is that the medication route of administration, that is not required by law on a written or electronic prescription, but it usually is included. And if it is included, it must also be documented on the prescription label. So for example, if the directions for use on the prescription specify PO as the route of administration, then the prescription label must include by mouth in the directions for use. Lastly, the date dispensed or the prescription expiration date on the prescription label does not match the date written on the prescription. And as we had mentioned earlier, if the medication is a controlled substance, the expiration date on the prescription label must be 6 months from the date the prescription was written. The last error to check prior to dispensing a prescription is to ensure that the correct cap is used, so either a child safety cap or an easy open cap. So if NSC is written on the prescription by the prescriber, a non-safety cap must be dispensed on that vial. And if NSC or EZ for easy open is printed on the prescription label, an easy open or a non-safety cap, either or, same type of cap, that cap must be dispensed on the vial. And a special note is that it is required by law that nitroglycerin, and nitroglycerin is a medication that is prescribed for chest pain and a possible heart attack. This medication must be dispensed with a non-safety cap so a patient can easily open the vial. And another note is that it is not required by law that topical preparations are dispensed with a child safety cap.